What is herpes in the eye? There are two common types of herpes virus: herpes simplex virus I, HSV1, also called oral herpes, and herpes simplex virus II, HSV2, which is genital herpes. These two forms of the herpes virus can spread to other parts of the body and cause lesions or sores. One area they spread to is the eyes, leading to epithelial keratitis, viral keratitis, herpes keratitis, or herpes in the eye. Typically, herpes in the eye comes from HSV1, transmitted when a person touches a cold sore on their lip and then touches their eye. However, epithelial keratitis can also stem from HSV2. Herpes in the eye can be controlled with antiviral medication, and it can be diagnosed during a routine eye exam. However, untreated herpes in the eye can damage deeper layers of the eye and eventually cause blindness. When HSV infects the eye, the infection hits the cornea first. This is the clear dome over the pupil, which is involved in refracting light onto the retina. Herpes never fully goes away, but most instances of herpes keratitis heal on their own, just like cold sore outbreaks. Severe forms can cause blindness if they are not treated. Causes and symptoms of herpes in the eye: itchy eyes, keratitis, or inflammation or infection of the eyes, has several potential causes, including bacteria, parasites, overexposure to ultraviolet, UV, light, or a virus, specifically HSV1 or HSV2. There are roughly 20,000 new reported cases of herpes in the eye in the United States every year, with 48,000 total reported infectious episodes. Symptoms of viral keratitis or herpes in the eye include eye pain, redness, blurry vision, sensitivity to light, watery discharge, inflamed eyelids, blepharitis. Herpes in the eye can reinfect your eyes if you wear contact lenses. If you develop these symptoms, take your contact lenses out and throw them away. Then, contact your eye doctor immediately for a diagnosis. Wearing contact lenses can increase your risk of another flare-up, or active virus, which can lead to lesions in your eyes. With any type of herpes virus that affects humans, the virus can enter the body and remain dormant for years. Forms of physical or emotional stress typically lead to the virus becoming active, either for the first time or as a flare-up. Common causes of flare-ups include emotional or mental stress, fever, physical trauma to the body, like an injury or surgery, exposure to UV light, including being outdoors or in a tanning bed, menstruation, some medications. Mild or moderate symptoms from herpes in the eye can cause issues that are frequently mistaken for conjunctivitis. These health problems include red, watery, irritated eyes, inflammation on the eyes and eyelids, pain in and around the eyes, tears or lesions on the surface of the cornea, conjunctivitis. Conjunctivitis is an inflammation and infection of the sclera, the white part of the eye. It is caused by exposure to chemicals or toxins, allergies, or bacteria. If your optometrist or ophthalmologist is unsure whether you have conjunctivitis or herpes in the eye, they will use a lab test to make a conclusive diagnosis. This is important, as treating these conditions helps you maintain healthy eyes and clear vision. But the treatment plans are different. Children are most likely to contract herpes in the eye, usually in a mild form called keratoconjunctivitis. They will have red, perhaps itchy or watery eyes, until the flare-up goes away. They may have another flare-up that requires treatment from their eye doctor. But for the majority of children, 1 or 2 outbreaks is all they will experience. the herpes virus will remain dormant for the rest of their lives. Treatment for herpes in the eye suppresses the virus. Getting an accurate diagnosis and appropriate treatment plan is important because severe forms of herpes in the eye can move into the stroma, a deeper layer of the cornea, and lead to stromal keratitis, which is harder to treat and can cause blindness. You may also develop iridocyclitis when herpes infects the iris. An optometrist or ophthalmologist will look at your eyes while your symptoms are active to make a diagnosis. Typically, lab testing is not necessary, but it can be performed in cases when the virus is less active, or symptoms are less clear. If a lab test is needed, this will be a fluorescein eye stain. Your doctor will use an orange dye that fluoresces under certain light, and apply this stain to the surface of your eye, where the epithelial layer of your cornea is. This helps your doctor see any layers of scarring that may be from past herpes outbreaks. Treatment for herpes in the eye is simple. Your doctor will prescribe eye drops or oral antiviral medications, which may be taken during outbreaks to suppress the virus and promote faster healing, or consistently for several years, depending on how severe and frequent outbreaks are when you are diagnosed. It is rare that herpes in the eye requires further treatment like surgery, but if outbreaks lead to scarring on your cornea or inside your eye doctor may recommend a laser procedure to remove scar tissue. There is no cure for herpes in the eye once you contract it, but like other types of herpes virus, it is easy to manage symptoms and suppress the virus, so you rarely experience outbreaks. If you have stromal keratitis, the more severe, deeper type of herpes in the eye, you may receive anti-inflammatory steroid medications alongside antiviral drugs. It is important to take medication as prescribed to reduce corneal scarring. This helps to maintain your vision. Repeated scarring and corneal perforation can require a keratoplasty, or corneal transplant, to treat. Herpes in the eye. Herpes in the eye of a cat. Herpes in the eye, how to get it. Herpes in eyes pictures. Herpes eye infection Hindi. Herpes eye infection pictures. Herpes in the eyelid. Herpes in the eye pics. Herpes in the eye images. Herpes in the eye photos. Thank you for watching, and please subscribe to my channel for my upcoming herpes treatment videos.